There are more than 100 types of known brain tumors, and some of them can be cancerous. The tricky thing is, many times there are no symptoms, which means the patient can be going for long periods of time with the tumor still growing. Joining us today to discuss is Dr. Vachhani, who is a neurosurgeon here at the Orlando Health Neuroscience Institute. Thanks so much for being here with us today.
Thank you for having me.
Okay, so we talked about sometimes there are no symptoms, but sometimes people actually feel a lot of different things. What are the red flags they should be looking for?
You know, it depends on what they have in terms of a change. So if they're having headaches their whole life, then it may not be anything. But if there's a new headache, new ringing, new weakness, new speech problems, anything that kind of has like a stroke-like symptom that can present like a tumor as well.
With so many different types of tumors, some of them being cancerous, some of them not, which are the ones that you really need to take notice of and take action?
I mean, the ones that are highly aggressive, the ones that spread from other locations, like a metastasis, someone who has a lung cancer that goes to the brain, those ones we really worry about because they can grow real rapidly. And the brain is unfortunately a special area that has a barrier called the blood-brain barrier. So a lot of the chemotherapy medications that we use to treat cancer in other parts of the body don't always go into the brain. So then that's why we have to use some different types of tools to be able to combat those.
Recently, there have been some new tools that have come into Orlando Health that allow you to literally see where the tumor and the cancer is.
There are some special medicines that we can give where we end up administering that medicine to the patient immediately before the surgery. And so when we're in surgery, we actually shine an ultraviolet light on the tumor itself, and we can see a bright fluorescent color so that we can really see, all right, this is where the tumor ends and this is where the normal brain begins. These are just traditional loops. This is something that's been used for hundreds of years to help surgeons do surgery. We basically will use this to essentially magnify the field and be able to see in greater detail where we're working. What we do then is we combine it with a light, and this light can also work as traditional illumination, but once you turn the whole room lights down, you can then turn it into a fluorescent light. That fluorescent light, when it shines on the tumor that's been given this medicine, will show as a bright pink color compared to the surrounding brain, which is more of a violet or blue color. And so then when we're in surgery, we can try to make sure we take out just the tumor and not take out the regular brain.
And if you would like more information, you can go to orlandohealth.com/neuro.